Hi guys, so today we will be discussing chapter 13, blood vessels and circulation. As we have discussed in chapter 12, the heart, our bodies consist of pulmonary and systemic circulation. Together we call them circulatory system. In this chapter, we will be discussing in depth of that circulatory system, the factors that affects them, and the variables that are included in the circulatory system. So let us discuss briefly the pulmonary and systemic. The pulmonary vessels is the vessels that carry the deoxygenated blood to the lungs so that it can be oxygenated and can be used by the heart and other organs of the body. While the systemic vessels are the vessels that carry the oxygenated blood to the rest of the body. So what are the functions of the blood vessel? So first, of course, it carries the blood. The blood vessel carries blood from the heart to all the tissues of the body and back to the heart. Next is it exchanges nutrients, waste products, and gases with tissues. As we know, nutrients and oxygen diffuse from the blood vessel to cells in essential area of the body. So waste products and carbon dioxide diffuse from the cells where they are produced to blood vessels. Next is it transports substances. Blood transports hormones. We call it the endocrine system that we have discussed before. Components of the immune systems, molecules required for coagulations, enzymes, nutrients, gases, waste products, and other substances to and from all the areas of the body. Next is it helps regulate the blood pressure. So as we go on with this topic, we will discuss all the reflexes and how the blood pressure is regulated by our circulatory system. Next and last is that it directs blood flow to the tissues. So the circulatory system directs blood to tissues when increased blood flow is required to maintain the homeostasis. As we have discussed before in chapter 1, homeostasis is the body's capability of maintaining the balance inside the body. And most of the way that the body perform the homeostasis is through negative feedback mechanism. We will discuss further about this feedback mechanism at the end of this chapter. So the vessel structure is divided into three. We have the arteries, the veins, and the capillaries. So if you will discuss this in your laboratory, you have to differentiate the three of them according to their structure that you will be seeing under the microscope. And then you will see that arteries is thick with a lot of elastic connective tissue and veins is thin with less elastic connective tissue. Further on of this discussion, we will discuss different layers of the arteries, veins, and capillaries. Artery carry blood away from the heart. All of the arteries carries oxygenated blood except for those that can be found in the pulmonary circulation. Veins carry blood towards the heart, and all of the veins carries deoxygenated blood except those that can be found in the pulmonary circulation. Capillaries exchange occur between blood and tissue fluids. The blood flow step-by-step procedure can be seen in this slide. So first, the oxygenated blood flows from arteries into the arterioles. From the arterioles, it will then go into the capillaries. From the capillaries, it will then go to the tissues where the oxygen from the oxygenated blood will be used by the tissues in their metabolic processes. And then from the tissues, the blood will then go again to the capillaries in a deoxygenated state, and then it will go to the venules. From the venules, it will then go to the small veins. From the small veins, it will then go to the veins and then return to the heart and be oxygenated again. So our blood vessel wall contain layers of connective tissues, muscles, and epithelial cells. So first we have the tunica intima, which is the innermost layer and are mostly simple squamous epithelium. The tunica media is the middle layer, which is a smooth muscle with elastic and collagen. Last is the tunica adventitia, which is the outer layer, which is mostly connective tissues. Different layers can be found on different types of blood vessels. Some of them are not found in a specific type of blood vessel. There are three types of arteries. We have the elastic arteries, the muscular arteries, and the arterial. The elastic arteries are largest in diameter. It is the thickest wall, and some example of it is the aorta and the pulmonary trunk. The tunica media is mostly elastic connective tissue, and elastic arteries recoil when stretched, which prevents blood pressure from falling rapidly. It has a very thick tunica media, which is composed of elastic tissue commonly and some smooth muscle. The muscular arteries is medium to small size arteries. It has a thick diameter and contains smooth muscle cells. It can control blood flow to body regions. The muscular arteries has a very thick tunica media that is mostly composed of smooth muscle rather than elastic connective tissue. The muscular arteries regulates blood flow to different parts of the body. Last is the arterioles. All three tunics are present, but the tunica media consists of only one or two layers of the circular smooth muscle cells. Unlike the second one, which is the muscular arteries, the tunica media is very thick, composed of the smooth muscle rather than the elastic connective tissue. Next is the capillaries. When the blood flows from arterioles, it will then go to the capillaries. The capillaries branch to form networks. Blood flow is regulated by smooth muscle cells in precapillary sphincter. So unlike other vein, etong si capillary, hindi siya lumiliit yung diameter ng butas. While the arterioles, habang lumalayo siya from our heart, mas lumiliit yung butas niya. Again, from the arteries, and then the elastic arteries, and then to smooth muscle arteries, and then to the arterioles, which is the smallest, and then it will then go to the capillaries. But from as the capillary branches, it never changes its diameter. The capillary wall is consists of only a simple endothelium, which is a simple squamous epithelium surrounded by delicate loose connective tissue. Similar to our arteries, we have three different types of vein. We have the large vein, the small and medium veins, and the venules. All of the three tunics are present in medium size, small size, and large vein, but in venule, only the tunica intima is present. For the large vein, all three tunics are present. The tunica media is thin but can regulate vessel diameter because the blood pressure in the venous system is low. So the predominant layer is the tunica adventitia. Compared to the elastic arteries, the most prominent layer in there is the tunica media, while in large vein, the most predominant layer is the tunica adventitia. The small and medium veins, while the medium vein and small vein contain all three tunics, and their purpose is to collect the blood from small veins and deliver to large vein. The large vein contains valves similar to the function of the valve that can be found in the heart. This is to avoid bifurcation or backflow of blood. So varicose vein result when the veins of the lower limbs become so dilated that the cusp of the valves no longer overlap to prevent the backflow of blood. As a consequence, a venous pressure is greater than normal in the veins of the lower limbs and can result in edema and swelling of the limb. So some people have a genetic tendency to develop a varicose vein. So the condition is further encouraged by activities that increase the pressure of vein. For example, standing in a place for a prolonged period allows the pressure of the blood to stretch the veins. And some example is that when the uterus is enlarged in pregnancy, it compresses the veins in the pelvic region and increases the pressure in the veins that drains the lower limbs. So first, let's have a brief summary of how the circulatory system works, meaning that includes the pulmonary circulation and the systemic circulation. So first, the deoxygenated blood will then be collected by your superior and inferior vena cava to your right atrium. and then it will travel to your tricuspid valve, and then it will go to your right ventricle. From your right ventricle, it will then travel to your pulmonary semilunar valve, to your pulmonary trunk, to your pulmonary arteries, and then to your lungs. This is where your blood became oxygenated. After the lungs, your blood will travel to your pulmonary veins and then to your right atrium. From your right atrium, the bicuspid or mitral valve will open, and then it will push the blood to your right ventricle. From your left ventricle, the blood will then go to your aortic semilunar valve, to your aorta, and then from your aorta it will go to your aortic arc, and then to your ascending and descending part of the aorta, to all over your body to start your systemic circulation. You can pause the video for this one. This is a short summary of how the blood vessels are involved greatly in the systemic and pulmonary circulation. Next part of this discussion is that we will discuss the most common arteries and vein that has a huge contribution in the circulatory system of the body. So first we will discuss the arteries, the major arteries. So one of it is the aorta, which is divided into three parts: the ascending aorta, the aortic arc, and the descending aorta. So the ascending aorta passes superiorly from the left ventricle. So it is the part of the aorta that is nearest to your heart. On the ascending aorta, we have an artery that we call coronary artery that directly supply blood to your heart. And the next part after the ascending is the aortic arc. From the aortic arc, we have three major arteries connected to it, and we will discuss each of them later. So three major arteries carries blood to head and the upper limbs. Next is the descending aorta, which is divided into the thoracic and abdominal arteries. So the descending aorta, as I have said a while ago, is divided into two: the thoracic aorta and the abdominal aorta. So the thoracic aorta is a part of descending aorta that extends through the thorax and to the diaphragm. So the abdominal aorta is descending aorta that extends from the diaphragm, where it divides at the common iliac artery. So from the diaphragm until the area where it divides from the left and right common iliac artery near your femur. So let's move on to your aortic arc. As I have said again a while ago, aortic arc is divided into three, or it branches into three types of artery. So we have the brachiocephalic artery, the left common carotid artery, and the left subclavian artery. You might be wondering that there is a left common carotid artery and there is a left subclavian artery, but where is its right counterpart? So the brachiocephalic artery branches into three. So we will discuss that later. And the two counterpart of the left common carotid, which is the right common carotid, and the left subclavian carotid, which is the right subclavian artery, is branched in the brachiocephalic artery. So the brachiocephalic artery is the first branch of aortic arc, and it supplies the blood to the right side of the head and the neck, as well as the right upper limb. So again, as I have said a while ago, from the brachiocephalic artery, this is where your right common carotid artery and right subclavian artery arise. So the last two parts or two branches of your aortic arc is the left common carotid artery and the left subclavian artery. So the left common carotid artery is where the blood supply of the head and neck came from, while the left subclavian artery is where the blood supply of your left upper limbs came from. So these two arteries are the counterpart of the last two arteries that I have mentioned a while ago, the right common carotid artery and the right subclavian artery. So these two branches off from your brachiocephalic artery. And the right common carotid artery is the one that supplies blood to your right side of the head and neck, while your right subclavian artery is the one that supplies blood to your right upper limb. So this is a short summary of how the blood flow from your arteries, from your major arteries, starting from your aortic arc. So as you can see, there are, from your aortic arc, again, we have three arteries that is connected to it. So we have the brachiocephalic artery, the left common carotid artery, and the left subclavian artery. And from your brachiocephalic artery is where your right subclavian artery and right common artery arises. So the major arteries of the upper limbs is the axillary arteries and the brachial arteries. So the axillary arteries is the continuation of your subclavian, and it supply the blood deep in your clavicle, while your brachial artery is the continuation of your axillary, and this is where your blood pressure measurements are taken. So on the distal part of your upper limbs, we have the ulnar arteries and the radial arteries. The ulnar arteries is a branch of a brachial artery. It is found near the elbow, and the radial artery is a branch of brachial artery. It supplies blood to forearm and hand, and this is where your pulse is taken. So let us move on to your descending arc, which is divided into your thoracic aorta and abdominal aorta. Your thoracic aorta can be divided into two groups, so the visceral artery and the parietal artery. The visceral artery supplies the blood from the thoracic to the thoracic organs, and the parietal artery supply the blood to your thoracic walls. The abdominal aorta, similar to your thoracic aorta, is then divided to your visceral and parietal group. There are three major unpaired branches of the visceral arteries. So these are the celiac trunk, the superior mesenteric artery, and the inferior mesenteric arteries. Again, so this is the unpaired branches of your visceral arteries. So the celiac trunk arteries supply the blood to the stomach, pancreas, spleen, liver, and the upper duodenum, while your superior mesenteric arteries is the one that supply the blood to the small intestine and the upper portion of the colon. The inferior mesenteric arteries supply the blood to your colon, while the following is the three paired arteries of the abdominal aorta. Again, this is part of your visceral abdominal aorta. So we have the renal arteries, the hepatic arteries, and the testicular arteries or ovarian arteries for female. The parietal branches of the abdominal aorta supply the diaphragm and the abdominal wall. This is called the inferior phrenic artery for your diaphragm and the lumbar artery for your lumbar vertebra and back muscle. The abdominal aorta come to an end by a two branching arteries that we call common iliac arteries. So this is the left and right common iliac arteries. Each left and right common iliac arteries is divided into an external and internal iliac artery. Here is a brief summary of the major arteries of the abdomen and the pelvis. Going down to both the left and right common iliac artery, we have found the arteries of the lower limbs. So like the arteries of the upper limbs, the arteries of the lower limbs are named differently as they pass into different body regions. So for example, we have the femoral arteries that supply the thigh or the area near your femur, and the popliteal arteries for the knee or the patella, and the anterior posterior artery that supply the blood to your leg and foot, and the fibular arteries which supplies the blood to lateral leg and foot. So now let us move on to the vein. So the vein returns blood to the heart. It carries deoxygenated blood except for those found in the pulmonary circulation. So in the systemic circulation, the blood returning to the heart is deoxygenated. So in the pulmonary circulation, as I have said, the blood returning to the heart in the pulmonary vein is oxygenated. Similar to your aorta, we have two major veins that carries all the blood from our body to our heart. So we call it the superior vena cava and the inferior vena cava. So the superior, of course, superior returns blood from head, neck, thorax, and right upper limbs. So it empties into the right atrium of the heart. Both of them actually empties into the right atrium of the heart. So the inferior vena cava returns blood from the abdomen, pelvic, and the lower limbs. Notice that when we are discussing the arteries, we start from the heart, the aorta, towards the tissue. While our discussion of the vein, we will start from the tissue and then to the vein that will carry the blood from the tissue to your heart. So we have two pairs of major veins that collect blood from the heart and neck that are the external and the internal jugular veins. So the external jugular vein are the more superficial of the two sets. So they carry blood from the posterior head and the neck. They empty primarily into the subclavian veins. While the internal jugular vein, it joins the subclavian veins on each side of the body to form the brachiocephalic vein. So the brachiocephalic vein join to form the superior vena cava. So again, external will drain blood from the head and neck, while the internal jugular vein will drain blood from your brain, face, and neck. So the veins of the upper limbs can be divided into deep and superficial groups. So the deep veins carries the blood from the deep structure of the upper limbs, follow the same course as the arteries, and are named for their respective arteries. So we have the brachial veins, the cephalic veins, and the median cubital veins. These three veins is the most common site for blood extraction. Median cubital is the preferred site or preferred vein to extract the blood. So we have three major veins that returns the blood from the thorax to your superior vena cava. So we have the right and left brachiocephalic vein, the azygous veins, and the internal thoracic. So we have the posterior intercostal veins and the hemiazygous veins. Sa posterior intercostal veins, it drains the blood from your posterior thoracic wall and drains into an azygous vein on the right side, while your hemiazygous vein receives blood from your azygous vein of the left side. Similar to your artery, we also have right and left common iliac vein. So again, they are also both divided into external iliac and internal iliac, each right and left common iliac vein. So here is a brief summary of how the major veins of the abdomen and pelvis contribute on the blood that flows from your inferior vena cava to your heart. So one of the most important part of the circulatory system is the hepatic portal system. So you will be discussing or you will tackle an in-depth discussion of this hepatic portal system in your clinical chemistry course soon. So liver is a major processing center for the substance absorbed by the intestinal tract. So together with the kidney, they help remove toxic substance from our body. And portal system is a vascular system that begins with the capillaries in the viscera or the organs near it and ends with the capillaries in the liver to filter all the nutrients, all the molecules that has been absorbed or brought by the capillaries to your liver. So it uses splenic vein and superior mesenteric vein. Similar to arteries, the veins has also their specific name depending on their location. So for example, the femoral veins, they are the veins that can be found near your femur and it drains the blood from thigh and empty into the external iliac vein. Next is the great saphenous vein. So it drains from foot and empty into a femoral vein. So sometimes great saphenous vein, due to its long structure, is used in some surgeries to compensate other parts of the body. So other veins in the body. So next is the popliteal vein. So again, it drains the blood from the knee near the patella and empty into the femoral vein. So we are done with our arteries and our veins. So let's move on to our blood pressure, how it is maintained by our circulatory system, and how the veins and arteries greatly affect the blood pressure. So blood pressure is the measure of the force blood exerts against the blood vessel wall. So it is divided into systolic when the ventricle of the heart contract and the diastolic where the ventricle of the heart is relaxed. So the average blood pressure is 120/80, meaning the systole should be 120 mercuric millimeter and the diastolic should be 80 mercuric millimeter. So an increase or decrease of the systolic and diastolic may cause a high blood pressure or a low blood pressure. So a healthy professional uses the oscillatory method to determine the blood pressure. So a blood pressure cuff connected to a sphygmomanometer is wrapped around the patient's arm and a stethoscope is placed over the brachial artery. So the blood pressure cuff is then inflated until the brachial artery is completely blocked. Because no blood flows through the constricted area at this point, no sounds can be heard through the stethoscope. So the pressure in the cuff is then gradually lowered as soon as the pressure in the cuff declined below the systolic pressure. The blood flows through the constricted area each time to the left ventricle contracts. So the blood flow is turbulent immediately downstream from the constricted area. This turbulence produces a vibrations in the blood and surrounding tissue that can be heard through the stethoscope. So this sound is called the Korotkov sounds. So next is the pulse pressure. So it is the difference between the systolic and the diastolic blood pressure. So example, the systolic is 120 and the diastolic is 80. So 120 minus 80 is 40 mercuric millimeters. So the pulse pressure points can be felt near the large artery. So the most exchange across capillary wall occurs by diffusion. So there are about 10 billion capillaries in the body. So nutrients diffuse across the capillary wall into the interstitial space and waste product diffuses in the opposite direction. So what are the mechanisms for moving the fluid through the capillary wall? So these are the blood pressure and the osmosis. So the blood pressure forces the fluid out of the capillary and the osmosis moves the fluid into the capillary. So fluid moves by osmosis from the interstitial space into the capillary because the blood has a greater osmotic pressure than does the interstitial fluid. So the water moves to areas of higher concentration of dissolved molecule, and the greater the concentration of the dissolved molecule in the fluid, the greater the osmotic pressure of the fluid, as we have discussed that on chapter 1. So mechanisms that control blood flow through tissues are classified as local control and the nervous and hormonal control. So first, the local control is achieved by relaxation and contraction of the precapillary sphincters. As precapillary sphincters are a sphincters at the end of the branching of the capillaries that is responsible for vasoconstriction and vasodilation of the capillary. So when the sphincter relaxes, the blood flow increases, and precapillary sphincter controlled by metabolic needs of the tissue. So concentration of nutrients also control the blood flow, and the blood flow increases when oxygen level decrease. So before we discuss the second mechanism, which is the nervous or and hormonal control of the blood flow, please read table 13.1 from your Anatomy Physiology series book, The Homeostasis Control of Blood Flow, for a summary of the mechanism that controls the blood flow. So the mechanism of nervous and hormonal control of blood flow is carried out by primarily the sympathetic division of the autonomic nervous system. So there is an area of the lower pons and the upper medulla oblongata. We call it the vasomotor center. So this is a sympathetic division of the brain that controls the blood vessel diameter. So as the consequence of the short-term control of the sympathetic division, the vasomotor center, the peripheral blood vessel are continually and partially constricted state. This condition is called the vasomotor stone, the vasomotor. While the hormonal control of the blood, again, the sympathetic division regulates the hormonal control of the blood flow through the release of a hormone called epinephrine and norepinephrine, or the adrenaline or the noradrenaline, from the adrenal medulla. So in most blood vessels, this hormone causes constriction, which reduces the blood flow. In some tissues, such as skeletal muscle and cardiac muscle, this hormone causes the blood vessel to dilate, increasing the blood. For the regulation of the arterial pressure, an adequate blood pressure is required to maintain blood flow through the blood vessel of the body. So there are several regulatory mechanisms that ensures the blood pressure remains adequate for this task. So we have the MAP or the mean arterial pressure, which is calculated value that reflects the average arterial pressure in the various vessels of the body. So it is slightly less than the average of the systolic and diastolic pressure in the aorta because diastole lasts longer than the systole. So the mean arterial pressure, the MAP, changes over our lifetime. So about 70 mercury millimeter at birth and is maintained at about 95 mercury millimeter from adolescence to middle age and may reach 110 mercury millimeter in a healthy older person. So the body's MAP is equal to the cardiac output multiplied by the peripheral resistance. So aside from the two discussed, we also have the baroreceptor reflexes. This activate response to the blood pressure in normal range. So it responds to stretch in arteries due to an increase in pressure. It is located in the carotid sinuses of the aortic arc, and it changes the peripheral resistance, heart rate, stroke, volume in response to blood pressure. So the baroreceptor reflex is an example of a negative feedback mechanism. Next one is another negative feedback mechanism that is involved in the blood control in our circulatory system. This is the chemoreceptor reflex. So the chemoreceptors are sensitive to changes in blood oxygen, carbon dioxide, and also pH if it's acidic or basic. So they are located in the carotid bodies near the baroreceptors and aortic bodies, which lie near carotid sinuses and aortic arc. So they send action potential along the sensory nerve to medulla oblongata. So after the adrenal medulla is stimulated by an action potential from your sympathetic nervous system, how does it help in controlling the blood flow? So first, the stimuli increases the sympathetic stimulation to adrenal medulla. And then the adrenal medulla secretes epinephrine or adrenaline and norepinephrine or noradrenaline into the blood. This caused an increase in heart rate and stroke volume and vasoconstriction. So vasodilation of blood vessels, skeletal and cardiac muscle. So how about the renin-angiotensin-aldosterone mechanism? The RAAS is a very important topic, most especially in your clinical microscopy. So, how does this RAAS or renin-angiotensin-aldosterone system affect the flow of blood and how it controls the flow of blood? Again, this is also an example of a negative feedback mechanism in your body. So, when the body detects a reduce in blood flow, it causes the kidney to release renin, and then this renin acts on the blood on a specific molecule we call angiotensinogen, which then produce angiotensin 1. So there is an enzyme that we call an ACE or the angiotensin converting enzyme, which will convert the angiotensin 1 into an angiotensin 2. Do note that angiotensin 2 causes the vasoconstriction, which is a very potent vasoconstrictor. Angiotensin 2 will act on the adrenal cortex to release aldosterone. This aldosterone will stimulate the retention of the sodium and water in your kidney. So there will be no urine output. More water will be conserved, and then it will increase the pressure inside your body. So it will increase the blood pressure. The renin has a very similar action to your ADH or your antidiuretic hormone. The hormone found in your posterior pituitary gland. So this ADH, when released, will stimulate the aldosterone in your body. The aldosterone will then help to conserve or retain your sodium and your water content in the body, and then it will not increase the urine output, and it will then maintain the regular volume of urine inside the body, which will increase the blood pressure in your body. So opposite to the function of your antidiuretic hormone in your renin, we have a molecule that we call atrial natriuretic hormone or atrial natriuretic peptide or just simply ANP. So its action is to decrease the blood pressure. It is released when there's, of course, an increase in blood pressure, then it will activate the kidney to release sodium and water. So there will be an increase in water loss, there will be more urine output, and then there will be lesser blood volume inside, which will then reduce the blood pressure in our body. So during aging, there might be a lot of diseases that can arise that originate from the circulatory system. First is the arteriosclerosis, which makes the artery less elastic. An example of arteriosclerosis is atherosclerosis, which is it forms a deposit of material in artery wall, which is mostly made up of cholesterol and calcium, and it forms a plaque. This plaque will attract more platelet that may form thrombus. So the factors that contribute to atherosclerosis might be lack of exercise, smoking, obesity, diet high in cholesterol, and trans fat. Some genetics factor also is involved in that. Ends my discussion. Thank you.